Good afternoon, I'm John Nycz. I'm with Michigan Orthopedic Supply. We're here to talk about BioE and CryoT. And I'm here with my good friend, Dr. Robert Schaefer, Dr. Bob. And we wanted to talk real quickly about what happens when we combine cryotherapy and bioelectronics. Both of these things do some neat stuff.
Absolutely. Unfortunately, in trying to improve the quality of a patient's life, I have to do some damage. As a patient who comes to me that has an arthritic knee that is painful, keeps them from doing what they enjoy doing, whether that's golfing, bicycle riding, or just taking a hike in the woods. When that knee becomes arthritic, I perform a surgery such as a knee replacement or a knee arthroplasty. The goal for my patients is to recover as quickly and efficiently as possible. And one of the ways that we do that is combining bioelectricity and cryotherapy. That is going to allow us to reduce the tissue damage, improve the healing time, to improve the process for that patient or individual to get back to doing what they love as quickly as possible. I'll let you talk a little bit more about the specifics of how BioE and CryoT works.
We can do that. We'll do it real quickly. The bioelectronics, it's essentially a function of creating additional available ATP, and it does a couple of different things. It moves the healing cascade more quickly. So there's a thing called the inflammation phase, and when you have inflammation, it's directly correlated to pain. If it's inflamed, it hurts. It's also more difficult, and it delays the healing process because there's another step in the healing cascade, the reconstruction phase. And until we move out of that inflammation into reconstruction, we're not really moving the healing process forward as quickly as we can.
The body knows injury, and the body knows to respond to injury by creating inflammation. And in the reality, inflammation is part of the healing process.
It is.
And it's a good part. Unfortunately, the body doesn't have a gauge to gauge that inflammation. What we've learned over time is that by modulating that inflammatory response, controlling it, the healing is going to take place faster, recovery is going to take place faster, you're going to get your patient more quickly to where you want them to be. And that's the goal of using cryotherapy with the bioelectricity in order to accomplish that goal.
Great. Well, let's talk real quickly about some of the innovations that have been brought forward. We really work with age-old technologies. They've been using bioelectronics. The ancient Egyptians were using it 4,500 years ago with electric eels. It does some really interesting things, and again, it's doing it at the cellular level. These are very low currents. This is a DC device. This is not a TENS unit. It does a much different function, and it's extremely easy to apply. This is a little bigger than a key fob for your car. So I am actually wearing one now. We rode mountain bikes this morning. I might have taken a tumble. My knee is sore. This is its innovation. One of the true innovations is staying on all night. So simply by putting this on and going to sleep, you are doing some incredibly valuable things biologically, which is very neat. The other thing that is big and important in this scenario, a lot of people aren't yet using ice. And that's a function of the fact that ice is a problem if it's too cold. These are set to stay at about 41 degrees, plus or minus a degree or two, for up to 4 hours. Really 5 in some cases. When they come right out of surgery, it can be a little bit less. But the big innovation here is the safety factor and just being easy. They patented putting Velcro on these pads. You're good to go.
Ready to go.
It's just that simple.
So the beauty of this system for me is the immediacy of which I can get it to the patient. Virtually in the recovery room, these tools can be used. And today patients don't spend days in the hospital. Some of them have their surgery, go home the same day. Most go home the next day. These tools can be they can take them with them. They can start to use them right away. So my goal is to have patients get this before surgery, learn how to use it as part of the preparation process for their surgical procedure. Now, same token, this can be used for someone who has an injury, somebody who simply falls and sustains a medial collateral ligament injury. And so they've got an injury, they've got tissue injury. They don't need surgery, but they need a recovery. They come in and they see me as a patient after going to the emergency room, and I can take this tool, send this tool home with them. They can put it to use right away. But you're going to take many of the tools that a physical therapist would use, and you have them right there in your home to use 24/7.
Right. And what we're seeing is that these rehab times are shortening, and the intervals between them. So sometimes, oh God, I can only get through therapy every third day. Well, now maybe we can do 2 days, and that's going to help, I think, with the capitation issue as some of the things change in the reimbursement side. But making it easy for the patient is a big part of this, and we've really worked to do that. You do something that's interesting too, is something you said the other day, putting the electrodes on right in the OR.
Absolutely. This is a tool that the surgeon can start the whole process in the recovery room, if you will. So these electrodes can come sterilized after I close my incision. Obviously, I've done a nice knee replacement, but I have created that tissue damage. So the sooner we start that recovery process, the better. By starting this process in the recovery room, that's going to only speed the process of recovery. And again, most of our patients today are in the hospital in a very short time, if at all. And so by having this tool to take with them home, they're going to increase that recovery time. And although we want to control pain with medications as needed, the less medication that we have to use, the better for the patient. So by using these tools, we're increasing the speed of the recovery process, and we're ideally decreasing the amount of narcotic pain medication they have to use, and all the downsides of narcotic pain medicine with confusion, constipation, and the downsides of that. So I want my patients to be comfortable, but I want them to go through that recovery process. This gives me great tools in addition to the traditional tools that we've used for many years.
Awesome. Thank you.
You're very welcome.
Appreciate it.